Hey, good morning, Kalispell. Hey, I hope everybody is doing awesome today, heading into Memorial Day weekend here. So, today we're going to talk about some things that you might not know, and it's something that I definitely have been talking about more in the office as of late, and it is mental health and chiropractic. The scope of chiropractic is pretty much as broad as the influence of the nervous system. And although many chiropractors and those they serve focus on disorders associated with the physical body, like pain, my low back hurts, my neck hurts, I have headaches, it's obvious that abnormal nervous system function may also affect psychological health. According to B.J. Palmer and D.D. Palmer, they were the first people to, quote-unquote, discover that insanity was caused by displaced cervical vertebrae. By replacing them, the patient could be restored to normal condition. B.J. Palmer also described in his expert testimony in a case, got a little notification there, that if the atlas, which is the top neck bone, is subluxated, what's that do to your brain? Pretty interesting thought there. It makes the brain function abnormally. That's the answer. So what's to be done in cases of insanity? He admonished some people to go back to the cause and adjust the cause of the symptoms, which would allow the brain to return to its normal capacity and capability. Several mental health facilities were established where chiropractic adjustments were the dominant clinical service provided. Two of these were located in Davenport, Iowa. In 1922, the Chiropractic Psychopathic Sanitarium was established. This facility later became known as the Forest Park Sanitarium. A judge in North Dakota, A.W. Pontath, noted that, my camera's slipping, that at a North Dakota state mental hospital, the cure rate and discharge ranged from 27 to 60. Their facility, their discharge rate was 27% compared to 65% up at Forest Park. The second facility, Clearview Sanitarium, was established in 1926. In 1951, Clearview was acquired by Palmer School of Chiropractic. Dr. Heath Quigley, who directed the sanitarium, described their clinical protocol. Each day, each patient was examined with the neurocalorimeter. We use the modern version of the same equipment here in the office. If the clinician interpreted the NCM, so the neurocalorimeter, to indicate nerve impingement, the patient was adjusted. Dr. Quigley reported that the rooms were sunny and bright, and that their meals included large servings of fresh vegetables from their garden. Unfortunately, both of these institutions closed. Forest Park closed in 1959 and Clearview in 1961, and large measure because of third pay issues. So that's like insurance, things like that. Insurance companies often refuse to pay the costs of care. Iowa statutes at the time did not provide for licensing specialized hospitals, which these were. Only full-service medical hospitals could be licensed. Clearview was not licensed as a hospital and functioned legally as a nursing home. In the 1970s, there was renewed interest in chiropractic care and mental health. In 1973, Dr. Schwartz, a chiropractor, published a book titled Mental Health and Chiropractic, a Multidisciplinary Approach. In 1949, Dr. Schwartz had published a preliminary report of 350 people afflicted with a nervous or mental disorder and reported that the majority of them showed improvement under chiropractic care. Dr. Schwartz was active in the ACA Council on Mental Health, formerly the Council of Psychotherapy, which survived through the 1970s. Today it no longer exists. In the 1980s, Dr. Quigley, who we talked about earlier, published an article describing a 4-decade period where treatment of the mentally ill was a highly motivated discipline within the chiropractic profession. In 1988, Dr. Goff published a review of the theory and practice of chiropractic treatment for mental illness. Interest in this field continues, and previously I've talked about the role of chiropractic care in children with learning and behavioral impairments. Dr. Gillen, she's a wizard with this. Pretty cool stuff. It's actually wicked awesome. So if you guys have, I'm going to talk a little bit about depression because there's a study here I have pulled up right now. And just this little case review, they had a study of 15 people with a history of depression using the Beck Depression Inventory. Second version was used to measure their baseline and any post-care changes following chiropractic treatment. Pretty cool. Across the board, the results, they improved. If you guys have any questions or comments, feel free, shoot them over to us in a message, and I'll do my best to respond to you. Have a great day, P.L.L.C.